by Garfield Burford. It will be posed to Team PNP.
What is your most radical approach to dealing with the issue of unattached youth, given the significant numbers we have in the society? The most radical approach.
The truth is that youth face a very serious challenge in Jamaica at this time. When we look at the statistics, close to 75% of all crime committed in this country is committed by persons who are under 30 years old. We also have 55% of persons leaving high school without having passed one exam subject, and 70% of our young people are not skilled to even be employable. What we will do is that we have to stem that tide. We have to make young people employable through training. And we plan to upgrade certainly the primary school and basic school training facilities by identifying the 200 underperforming primary schools and basic schools to upgrade them. And we also plan to go and give them job opportunities in the areas of information and communications technology. We plan to do it in agribusiness, and we plan to do it in construction. So when you see a People's National Party government on the move, we'll build up parish youth teams for construction, we'll have farmsteads for farmers in the short run, and certainly we'll put them in telecommunications call centers as well.
Thank you, Team PNP. We'll now have a 45-second rebuttal from Team JLP.
I want to thank my opponent for her endorsement of the CAP program. Under Prime Minister Holness, he has taken unattached youth and placed them into programs that enable them to be more, to acquire vocational skills, to be numerate, to be literate, and to acquire the soft skills in terms of deportment, in terms of conduct, in terms of discipline that will make them more productive citizens and qualify them for the workforce.
Thank you very much, Mr. Newby. Mr. Garfield Burford from CVM TV has indicated that he would like a follow-up question.
Right. In the context of tight fiscal constraints, how would this be funded in terms of improving the quality and upgrading primary and basic schools?
Well, the first thing that the PNP believes in is economic growth, and we have our plan for economic growth. But secondly, just in the same way that there were no new funds when the government embarked on the CDF program, we plan to adequately reallocate public sector funding that's already available to make sure that we put it in the right place for the construction parish build youth teams, for the farmsteads where we will give young people 5 to 10 acres of land. I want to say to the Senator that unfortunately the CAP program is not working. Over 60% of the NYS budget was cut, and we've also seen a reduction since 2007 in the hard figures, where we've dropped in enrollment from over 5,000 to a little over 1,000. So he needs to check his figures accurately.
We'll now have a rebuttal from Team JLP.
Well, the figures for Hard Trust NTA prior to now were greatly over-exaggerated because they were counting units done by students rather than persons who had been enrolled into the program. So for each unit, it would be recorded that a person has completed certification, when in fact, if a person did welding and went on to do mathematics, they would be counted 2 times instead of 1. We took a policy decision to discontinue this practice, and we are proud to say that since 1994...
Thank you very much, Mr. Newby. We will move on to our question. The next question is from Nadine McLeod. It will be posed to Team JLP.
Yes, should the existing age of consent be maintained, and why?
Could you repeat the question, please?
Should the existing age of consent be maintained,
Which
and why?
is age 16. Yes, correct. I was just making sure I had your question correctly. That is a question that relates to the socio-developmental issues of a young woman at that age and stage, and also young men also, but I focus on women because at that age they're the ones who are most vulnerable for the negative consequences of early sexual involvement. Age 16, at that age a child is at the stage of intimacy versus, identity versus confusion. They're trying to find who they are, literally. A teenager at that age is trying to find who they are. They're trying to figure out where they fit in society. Their greatest influences at that age is their peer influence, because that is where their interactions determine where they will go in life. And as such, if you lower the age of consent, you're putting them at risk for even wrong decisions that could lead to very, very serious consequences later on. It is a very...
Thank you very much, Dr. Longmore. Let's move on to a rebuttal from Team PNP.
Not so much of a rebuttal, but better redress of the question that has been posed. The issue of the age of consent is really about the initiation of sexual activity. The age of consent makes a distinction between what is considered statutory rape versus what is consensual sex. I think the most important area to focus our attention is to ensure that adequate information, resources, and skills which will allow people, young adults, to come to decisions that are in keeping with their better outcome later on in life is what is to be supplied. We need to go back to the long-held view from the Western African proverb that it takes a village to raise a child. More members of the national
Thank you very
family
much,
at the
Mr.
community
Pryce.
level
Let's
need
move
to
on
be able
to
to
the
do
next
that.
question. It's Ingrid Brown to Team PNP.
If the PNP is elected to office, will it immediately reverse the no user fee policy? And if yes, how will it ease the health care cost burden on the poor?
The PNP will not immediately reverse the no user policy. What we're saying is that we agree that healthcare delivery shouldn't be based on finances. We agree with that. And I want to remind Jamaica that it was the People's National Party on May 27, 2007 that first removed user fees for children ages 0 to 18. That was done by Portia Simpson Miller. Now what we're saying is that we want to engage our stakeholders. We want to bring them to the table and say, we want to sit down and determine what is the minimum standard of care that we can afford to give. So that's the first thing, consultative governance. The second thing that we want to bring to the table is a focus on primary health care. If you focus on primary health care, you automatically address 80% of the needs of the population. When you have a third of the persons who are diabetic not knowing, and 80% of them who are hypertensive not controlled, then primary health care must be the focus. We also want to look at mobile health clinic, refurbishing of the health centers, 340 to
Thank you
benefit
very
over
much,
700
Dr.
communities.
Campbell. Moving on now to a response from a rebuttal from Team JLP.
I'm glad that Dr. Campbell has recognized that an immediate reversal would not be a wise move. Indeed, there is no empirical data. Actually, a World Bank study done reflects that the removal of user fees and the implication of payment at healthcare facilities actually reduces the usage by persons who are supposed to benefit from it. Only 12% of persons of the low-income category actually get to access user fees, get to access healthcare, when you have implemented user fees. Regarding the primary healthcare center development, we have actually, our administration has actually embarked on that, spending over $500 million improving hospitals since our administration has taken office throughout Jamaica. The Mandeville Regional Hospital.
Thank you very much, Dr. Longmore. We'll move on to the next question. It's from Garfield Burford to Team JLP.
To quote a sentence from your manifesto in 2007, the JLP said, our youth must be at the center of our development. How then do you square that or reconcile that with a cut in the supplementary budget in education and youth to the tune of an aggregate of about $165 million early this year?
Well, the very first thing is that we must approach youth from the perspective of youth mainstreaming. The budget of education and youth do not reflect the entire spend on youth because health, national security, industry and commerce, and all other ministries have agencies and programs under their mandate that are directly related to our youth. Beyond that, we have engaged the international donor community to augment and support our budget in education and youth.
Thank you very much, Mr. Newby. Let's get a rebuttal from Team PNP.
Well, if that is what the JLP has to come with, it really has abandoned youth, because in the Ministry of Youth and Culture, of the $1.9 billion in recurrent expenditure, only $83 million is actually spent. It needs to be a reversal in terms of how we look at the majority of our population. What is most interesting with the JLP as well, if you look through the budget, the most significant increase towards any kind of spend is towards juvenile centers. And they've increased that to over $500 million to $800 million. They're spending more money to lock up young people than they are to train them.
We now have a follow-up question. Mr. Burford has indicated that he'll have a follow-up question. Just a reminder that each journalist is allowed 2 follow-up questions during the entire debate.
Of the aggregate 165 million, this was the second time since the budget cut this year that there was a deferral of the building of youth information centers. There was actually a deferral from last year as well. How would wouldn't this adversely impact on youth?
Mr. Burford, the contracts for the 2 centers that were deferred are to be signed shortly. Cabinet recently approved those for Spanish Town and for Maypen in Clarendon. What happened was that the land acquisition process and the approval process was delaying the other approvals that run concurrently. And as such, we had to take a decision to delay the implementation until later on in the year. We are proud, though, to say that when we came to office, there were only 4 youth information centers. Today, there are 9.